Good morning, everyone.
Good morning.
Welcome to the MIMIT Health Live Life Fibroid-Free Health Talk on Fibroids and what you need to know. I am Vivian King, and I will be your host today. MIMIT Health is here to serve you in the best way possible. Take a listen.
Welcome to MIMIT Health. We're one of the fastest growing physician groups and health system in the country, and we are here to serve you. We specialize in minimally invasive procedures, whether it's spine, arteries, veins, prostate, fibroids. We do a wide variety of things, but we're here to solve your problem for you. We have some of the most highly talented, qualified, humble people who are here to serve you. We believe in servant leadership and to care for.
We are ready and available to serve you now. Call 708-486-2600. Telehealth services are also available.
Wasn't that a great video? MIMIT Health puts the care back into healthcare. And we are gathered here today to talk about fibroids, the symptoms, and most importantly, what are your non-surgical options for relief? A quick question though before we get started. Ladies, we want you to take a moment and enter your age in the Q&A or chat section of your screen and let us know if you're in the age group 20 to 30, 30 to 40, 40 to 50, or 50 plus. Also, in the meantime, we want to remind you that if you have questions during the talk, please just submit them in the Q&A or on your screen in the chat, and we will present those questions to Dr. Chopra at the end of the session. Now, to get us started, we are going to hear from someone who was just like you, our patient advocate, Miss Romi. Take a listen.
My name is Romi. I'm a registered nurse. I work in the hospital. I've had an experience of fibroids for a couple of years. So during the course of the fibroids, when I was having it, I would be having like a shortness of breath because my stomach is like up into my epigastric area. And each time when I eat, I'll be having nausea. Sometimes I even vomit. So it's kind of very frustrating thing for me. So when I discussed with one of my friends, he introduced me to Dr. Chopra. So the date was set for UFE. Afterwards, after 2 to 3 months, I started having a little bit relief. Like I'm not going to the bathroom anymore. Not frequently like as it used to be. It's reduced. From the preparation room to where the procedure, the whole thing did not take more than 3 to 4 hours, and I was discharged home. No nausea, no vomiting, no bloating, nothing like that anymore. I'm free. So I would recommend it because it's not invasive, that somebody will be caught, that you will be nursing a wound for months, and at the same time I've seen people going through those procedures like having a surgery that do not make it. I think this is a very good procedure for women that are having fibroids.
Thank you, Romi. Thank you so much. In our quick survey and poll, we had a variety of women say they were in their 20s to 30s, 30s to 40s, but the majority of you were in your 40 to 50 age category. And I'm sure there are some of you who can relate to those symptoms that Tommy talked about. So by being here today, you are on the road to recovery, as Toby said. So she is free. Ladies, I would like to introduce to you Dr. Romi Chopra, who is the interventional radiologist and CEO of MIMIT Health. Dr. Chomi, I know you can't see me right now, but we can see you. And so I am here and you know what I look like. So anyway, we're so happy that you're here, and let's just get right into this talk because we really want to hear from you. And we heard Tomi in the video talk about, her issues, but let's kind of level set and just share with the audience what a uterine fibroid is.
Absolutely. And, let me also share part of my screen and show you some graphics as well. So uterine fibroids are essentially benign tumors of in the uterus. They're non-cancerous growths. They can be multiple sizes in different places. They take up blood supply, normally within the uterus. What I'd like to do is step back for 1 second and put everything in reference here. And the reference is that, the uterus is nature's wonderful system for sustaining life. It's the size of a human fist, as you can see around here. You have the fallopian tubes, the ovaries. And if there's no uterus, there's no life. And that's what makes woman the center of our universe, because without the woman having a child, there's no family. And most of the women today support the family and everything else around them. And the uterus prepares every month as if it's getting ready to have a baby. And the inner lining matures ready for the pregnancy. And if it doesn't happen, we have a normal menstruation, which should be totally painless and without a problem. When we have these fibroids, which normally you have muscle here within the uterus, which as if a baby has to expand and grow in there, it expands. And then when the time comes, it's got to push it out. So it's a smooth muscle, just like you have muscles anywhere else. These benign little tumors, they're not cancerous, which is important to know. And when I say benign, they're not going anywhere, but they cause a lot of trouble. Also kind of get a lot of blood. They can be very tiny to fairly large, and that's when they start causing problems for us. Does that make sense to you?
It makes a lot of sense. And I kind of know that because I had fibroids at one time, and we had pictures of them, and they were not very pretty at all. So what causes uterine fibroids?
There's a lot of research on this, and nobody really seems to know. There have been some studies that have shown that maybe in the African-American community, where it's very, very common amongst the women, African-American and Latinas, as much as 80 to 90% of women in those communities will have it. They linked it to some, perhaps, use of hair dye, but I don't think that's really the cause. There's a lot of familial and genetic predisposition to this. So grandmas have it, mothers have it, their daughters have it. But most important that it happens in the childbearing age group. So it's linked to estrogen. And as long as there's estrogen, that will grow the estrogen is needed for normal functioning of the female reproductive system, but they also support the fibroids. And after menopause, when the estrogen is not needed anymore, it's not present anymore, the fibroids tend to shrink. But these days, there's a lot of hormonal therapy, et cetera. So we've started to see them a lot, even in the postmenopausal. So coming back to it, there's no real factor that says you do this and you get a fibroid. It's in families and linked to childbearing and estrogen.
You kind of touched on a little bit of my next question, which is going to be how common are uterine fibroids? Everybody can get them, right? And one thing you mentioned about the cause, I rarely had hair dye, so I don't know that caused mine or led to that at all. But just how common are they amongst everybody?
It is very, very common. And you see, I mean, as a woman, you know this, you're the kind of the center pin for your family as a mother, as a wife. And a lot of women today are working and supporting everything else. So you're used to going through a lot of trouble and not complaining about it. And so it's so common that a lot of women even think it's just part of normal growing up, etc. It's only when it gets really excessive that folks come to me. So, just to show you a little graphic on how fibroids will present, the commonest we see is bleeding and then they become anemic. I've had women who, as part of their normal cycle, were bleeding for 3 weeks out of the month. And they thought it was okay. It's just part of their stuff. But I've had women who've had transfusions every few months. The next commonest thing is a lot of cramping, pain, discomfort. Again, a lot of them will think it's just part of their normal menstrual period, so to speak. There's also a little stigma about talking about this. There's the next thing that happens is the fibroid gets really big, and I'll show you some pictures in a little bit. They can cause pressure on the colon and the bladder, and also the belly feels big. I've had women come in who thought they were pregnant, and then they found they were not pregnant, and they actually had a massive fibroid. And sometimes then the fibroid itself will not allow the pregnancy to continue, and they can get miscarriages.
Yeah, it's interesting because when my OBGYN found my fibroids, and I had not had any symptoms at all, but we scheduled for them to be removed, and it was so ironic that the week of my procedure, that's when I started to have the heavy bleeding. I never really had pain or anything, but I thought, wow, this was just unimaginable. So how are they diagnosed typically?
So, a lot of times women will have these problems, and then they'll obviously go to the gynecologist or the other doc, and then they'll get most likely an ultrasound. And then they're told you have a fibroid. Unfortunately, most of them will jump straight to some big surgical procedure, most commonly hysterectomy. And it's not just here in the US, it's practically around the world that this happens. I like to joke about it. If you go to Midas, you'll get a muffler, even if something's wrong with your tires. So, the folks who do hysterectomies and don't do fibroid embolizations, for example, don't often talk about it. Now, uterine fibroid embolization, which is one of the most minimally invasive options for this, it's level 1 recommendation by the American College of Obstetrics and Gynecology. And there isn't a lot of information, and there's not a lot of this shared about it. And that's one of the reasons why for the last decade or so, I've been around the world raising awareness about this, avoiding unnecessary hysterectomy or unnecessary big surgeries, and come up with minimally invasive options.
So what we really are here to talk about is how are uterine fibroids treated?
So let me actually share a little slide here with you, and you will see that here we go. So there's a whole wide variety of things. I believe in holistic care, which means you encompass the spirit, the mind, and the body. The spirit is where we feel, the mind is where we think, the body is our body. Unfortunately, most care and most of treatment options are as if you're taking care of a car, and it's just on the body. So I see, people talking about, oh, just meditate and everything will go away, just pray and everything will go away, or just change your diet and everything will go away. So that's one extreme of this. The other part is where there are some hormonal therapies, etc., but they don't just cure it. We've had patients be given Lupron, for example, which is basically a chemical menopause, and it's not something that you really want. On the other end, you have open hysterectomy. Now, these fibroids make the uterus large, so that's the commonest thing, that they'll end up getting an open hysterectomy versus just laparoscopic. Then the next option is the myomectomy, where just some of these fibroids are removed. And in there is uterine fibroid embolization, and we'll talk about this. So just to give you an example, as a woman, what would you choose? Hysterectomy with open surgery versus you have something where we go through the wrist, you go home with the Band-Aid in a few hours from the time you came in. On one hand, you have a big abdominal incision. This is a very costly procedure. You're in the hospital for a while. It's painful. It's more expensive, to say the least. And when I say expensive, expensive to the body as well. You suffer through a lot. You can get complications, rate, general anesthesia, etc. Versus on the other hand, you have something that's easier, it's better, it's faster, it's non-surgical. And to make this kind of visible to you, you can see here in these fibroids, they get big when you're looking at hysterectomy, and now you're looking at a big scar. Versus when we do this, we actually go in through the wrist. Where do we go in? We go into an artery, just like getting an IV, and we put a tiny little tube under X-ray guidance. We'll get it all the way down into the artery that feeds the uterus and the fibroid, because the fibroid wants a lot of blood, so it picks it up. We put some particles in it, and that shrinks and stops the blood supply to the fibroid. Just like in your garden, you have weeds, you spray your garden versus getting rid of the whole garden. And we see then, here was a fibroid before with the red arrow, and this is afterwards, after a few weeks where it's done. And in the end, when procedure is done, you have a little bit of a wristband. This is the spot here where we put the IV, so to speak. And after the procedure is done, about a half hour later, this is removed and the patient goes home. So, that's the spectrum, if you would, of the different treatment options that we have.
Wow. Because I had a myomectomy, a laparoscopic myomectomy, and I was in the hospital for a day and a half, maybe. So that UFE sounds like something that I definitely would have considered if I had the option and was told about it. And so I'm wondering how many of our attendees have heard about the UFE. So can we there's a poll up now to see if you have heard about the UFE before today. We'll give you a second to do that. And we see that most of our attendees have not heard about it. 57%. Some of you have, 43% of you have, 57% of you have not. And so I guess the next question really is, if I choose the UFE treatment, what should I really expect from that time?
Yes, so the very first point here is that as we evaluate the patient for a UFE, we want to make sure, number one, that you don't have a cancer or anything else. We make sure that we have an endometrial biopsy, and also we always do an MRI. The MRI then allows us to understand, get the size of the uterus, get the size of the fibroids, etc. Once this evaluation is done, we take all insurances, and it is much, much cheaper than going into a hospital. To give you an example, nice to see you, baby. Fun.
Yes, I'm here. I do exist, attendees.
So one of the important things to realize in today's COVID era, for example, hospitals, I've said this forever, so we do 99% of our work outside of a hospital. Sick people go to hospitals, and you'll land up, there are a lot of bugs out there, and you'll land up getting all these infections. There's MRSA, there's all these other things. But more importantly, in today's COVID era, you don't want to be in a hospital and grab something. So we are entirely COVID safe. We take every precaution there is. We make sure all of that part in today's world. We do this all in our outpatient centers, where just as you heard Romi, somebody comes in the morning. We obviously do this under mild sedation. We always have an anesthesiologist present, but there's no general anesthesia. It's like getting an IV and some medication. We make sure that you have enough pain medication in case you have pain. And then after that, when the procedure is done, you come out, you have that little thing on your wrist. Now, if you're in pain, what do? You want to get into a fetal position, you want to go to the bathroom, you can walk. And so by doing it through the wrist, versus we otherwise can go on the artery on the hip, which is how it was done before, you're ready to get up and walk around. So, if you come in at 8, for example, you're ready to go home by noon. That's the majority of the patients. I've had some patients don't feel much pain at all. Some feel cramping, just like a heavy menstrual period. And especially after the procedure, when the fibroid is now starved for blood, it's going to call out to you and say, hey, I'm hurting. Why are you, what's going on here? And that's the chemical that we perceive as pain. So we give you enough medication to block those chemicals. So I've even had women who, and I remember one, she had a very large uterus. She was of Indian origin, and she and a mom, and they happened to be from where I was in India, and they found me through the web. She and a mom actually went and had lunch afterwards when I called them to see how they were doing. So, this compared to being in a hospital, general anesthesia, open surgery, all that stuff. And so that's kind of almost the routine that we see. After the first 2 days, the uterus is kind of responding. So women get some cramping pain. So we say, listen, rest at home for those next 2 days. We'll give you enough pain medication if you need it. We try to stay away from the opioids. And then after that, most women, about the 3rd or 4th day, are back up and about and doing their things. And, once it's done, we've rarely had a recurrence. I've been doing this for 20 plus years. And the UFE has been around for a long time. And we'll talk about that in a second, I'm sure.
Yeah, because I had never heard of it, and until recently, and as you saw our poll, most of our attendees had not. But we are getting some questions from our attendees, so I'll launch right into those if you don't mind.
Sure.
One question is, will this treat all fibroids, and what if I have a lot of fibroids?
It treats all of them. The analogy that I give is, I call the uterus the garden of life, right? So every month it gets ready to kind of have more life. Now imagine you have weeds in the garden, which are fibroids. And what do? We spray the yard. So the same way when we do this, it affects all the fibroids, it shrinks all of them. And really what we're trying to do is get you back to normal functioning, stop the bleeding, stop the pain. So yes, it treats all of them.
Excellent.
And I just threw up this slide if you can see it. Condoleezza Rice, this is public information, of course, it's in the news, in 2004 had this. We are in 2020, and we still don't have awareness around this. I've been conducting a lot of seminars, and I've spoken at many churches, as you know, and almost 40 churches in the Chicagoland areas, Indian Council and other events, to raise awareness about this. And the more the conversation around this, the better it is.
Right. I mean, I had my myomectomy in 2005, so I was not told about this procedure. More questions. What would you recommend UFE to those who have never given birth?
Yes. So here's the thing. So initially, when this treatment was actually discovered serendipitously by a surgeon in France, when he would remove these fibroids, they would bleed a lot. So he figured, hey, why don't we stop the blood supply to the uterus before I do the surgery? And one of the things as an interventional radiologist, if they've had surgery, if some women have a C-section or some other surgery and they bleed a lot, they would call us to go in and stop the blood supply to the uterus and save their lives. So that's what we used to do. And we still do that, of course. But then this surgeon discovered that the fibroids shrank and disappeared. That's how the treatment came into being. And I'd like to spend a couple of minutes and a slide just to show you how this works, if I may.
Mm-hmm.
So you see, earlier we did it from the artery on the hip. We actually put a small catheter, it's like a long linguini. It's the same that we'd use for cardiac catheterizations and angioplasties. We put that catheter into the artery that feeds the uterus. And the fibroids take up a lot of blood. That's what they do. And this catheter, for example, that goes in, and then we can put the particles and then we block it. The particles are these benign, small little particles. They are like little gelatin balls. There are many different types, and they're so small. They go into the uterus, they go into the fibroid. The normal muscle does just fine. Just as when you spray the yard, the normal grass does fine, but the weeds shrink. The same way, we kind of put these particles and we make sure that the fibroid shrinks. So here's an example of a 53-year-old who had almost the size of a 6-month pregnancy. That's the fibroid right here. And you can see after we had done it, you see the white part that's lighting up here? The white part is all the blood that the fibroid is taking up. You can see when she had an MRI in 3 months that it is now completely dry and not white like this. This white here is the bladder. And you see how here the bladder was squished. So this lady would go to the bathroom all the time. That's the pressure part of this. The other thing was obviously pain. Is the pain that she felt, and she bled a lot. Just as the fibroid gets a lot of blood, then the patient would bleed, the lady bleeds a lot. And you can see by the end of the year, all this has shrunk. But her symptoms improve almost immediately. Now, if you have something this big, imagine whether you can have a pregnancy in there. It does, because it's competing with the size for the baby. So when the initial treatment came about and this was being done, it was not studied for whether this is for fertility. This was to treat the fibroid. There are enough studies that have shown that women have gotten pregnant after the surgery. Now, if you have a hysterectomy, you're not going to have a baby anyway. If you have a myomectomy, studies have shown that the pregnancy rates after myomectomy and after UFE are the same. And here you have a less invasive option and the same chance of having a baby.
Absolutely.
I hope that answered the question.
I think it did. We have a couple of other questions as well. Like, what is the particle? You kind of talked about this. What is the particle you inject into the artery or fibroid, and is it a chemical?
Oh, it's just a particle. There are no chemicals. These are inert. There's no radiation. There's no effect of this of any time. When I say inert, they go in there. As the fibroid shrink, these things just absorb and disappear.
Do you have to be under anesthesia for this procedure?
So the way this works is when we are conscious and alert, I'm breathing by myself. You ask me to do something, I can respond. So we have different stages of anesthesia, and some people get confused. The far extreme is general anesthesia, where you cannot respond to anything. You're paralyzed, you have a tube down your throat, you can't breathe on your own, you can't feed. That is what is required for an open hysterectomy, because you can be talking, etc. What we do is what we call conscious sedation or deep sedation. It means that just like if you have a couple of drinks and you feel sleepy and you're kind of numb, we give you a little more than that, and there's somebody who monitors your breathing. But if we ask you something, you should be able to respond, and you breathe on your own. That is very, very important, because there are higher complication rates with general anesthesia. When I say general anesthesia, it's where you have a tube down your throat and you're not breathing for yourself, which is what is needed for hysterectomy. So to come back, what we do this is under deep sedation or conscious sedation, and you basically, no pain for the procedure, and most times because of the medicine we give you, you don't even remember the procedure.
That's awesome. And we had another question. You've already answered it. Can you still conceive after UFE? And you said that, yes, you can. We have a question. Does everyone offer it? And clearly the answer to that is no. And I guess my question after that would be, why doesn't everybody offer it?
So, one is you need the kind of expertise to do this. Um, there are all kinds of technologies and tools everywhere. The other thing is there's not a lot of awareness about it. Most of the people who do it tend to do it in hospitals, and there's a lot of misinformation around it. But the commonest factor is this. A woman has heavy bleeding or problems, she goes to a gynecologist. Gynecologists are not, they're wonderful people. I have a lot of friends who are gynecologists. I wanted to be a gynecologist when I was in med school, but they don't do this procedure. It's not in their expertise range. There are a lot of other things that they do. So they are not often as aware about this. So they would see if they know hysterectomy, to say, listen, I can do an hysterectomy, I can do a myomectomy, I can put your Lupron, whatever. The ones who are aware will pass on the information, but it's really a problem of raising awareness around this.
Mm-hmm.
And I have patients from all over the world. I've taken patients, from other countries. I've done them from multiple states in the U.S. And now with telehealth, it's become even more prevalent. And I've had patients who fly in from another state. We've had them stay locally. We've done everything digitally. We are fully digitally transformed organization. Then we have them stay locally. We take care of them. It's all outpatient. Everything is good. We also have protocols for if God forbid something goes wrong, and touch wood, we've never had that problem. We have all of those things in place. And that's the beauty of doing it outpatient.
Mm-hmm.
But, I've had a lady who was in a heavy COVID state. She's bleeding 3 to 4 weeks out of the month. She's in heavy, just getting anemic, doesn't want to get admitted to a hospital. She drove up here. We took care of her. She's fine. And outpatient, it's essential services versus her being at risk in a hospital.
Absolutely. We have some questions that you've kind of talked about, but just, if there's any other nuanced answers you want to give.
Sure.
One person says, can UFE harm the uterus? It sounds like it doesn't if we can get pregnant afterwards, right?
No, it doesn't. It doesn't. Now, just as if there's, you'll see reports in the literature of had some problems. Now, in the right hands, any tool, if you're a chef and you don't know how to cut, you're going to cut your hand. You can't blame the knife for that. Similarly, but it's a very, very safe procedure.
Mm-hmm. And then we have someone who says, and you kind of talked about this as well, is UFE for all types of fibroids. They really don't want surgery, but UFE sounds great to them.
Yes, it's for all kinds of fibroids. And the uterus has 2 arteries. So from your garden, you have 1 artery on the right, 1 on the left. We get into that and we hit the whole garden, the whole uterus, and it shrinks all the fibroids.
That's awesome. And you kind of touched on this as well, but someone is saying it's done by a radiologist, correct? As opposed to, like they're OBGYNs, they're not going to necessarily have this expertise.
Yes, yeah. So, we go through extensive training. Earlier, the people get confused by the word radiologist. But what it is that interventional radiologists are like minimally invasive surgeons. And in the past, you had to first become a radiologist, understand imaging, and then specialize in interventional radiology. Now, interventional radiology is like a surgical specialty. It has its own training program, but we learn imaging. So the best way to describe this, if you go back, we fight a war against disease. So here we're fighting a war against the fibroid, so to speak, right? Now, in the old days, when there were wars between countries, when Germany and England, they did carpet bombing of the whole city, right? So that is open surgery. You'd have a lot of collateral damage. How are they doing it today? Under imaging, which is laser, they will watch in night vision just the bad guys and try to knock them out. That's what we do as interventional radiologists. I kind of, jokingly, I'll explain to people, we are like the Navy SEALs.
Sounds like that.
The equipment will get right into the point because we use the same technology to treat cancers in the liver, in the lung, other places. We want the least amount of collateral damage. And then we want the patient to obviously not suffer from any pain, but we also want it to be cost effective. I call it the Amazonification of healthcare. You do it better, you do it faster, and you do it cheaper. And as humans, what do we want? We want to live as long as we can. So we hate dying in any kind, no matter how old you are. And we want a great quality of life. And for success, in my mind, is fulfilling your God-given potential. So how can you do that if you're bleeding 3 weeks out of the month, or if you're in severe pain? How can you be a good mother? How can you be a good wife? How can you be a good lover? And that's one of the commonest things we see, is that their sexual relationships with their partners suffers a lot. And that leads to all other emotional, psychological, spiritual issues. And a simple treatment like this, I've had patients I took care of 20 years ago when I first started this. They're still friends and they do great. I've done this on family members. I've done this on friends. I've done it patients who become friends. So
Yeah. Yeah, you would be my friend. You're already my friend, but you would definitely be my friend if you did this for me. We have a question. Will I stop having menstrual cycles or periods? And how long before you're back to normal?
yes. So what we commonly see is so most of these women come to me, they're bleeding like crazy, and they don't complain if they're not bleeding anymore.
Right.
So we see that there's amenorrhea, which means for the first month or two, they may not have a period. Then they will get closer to getting back to some period, and then get back to a normal rhythm. That's one. We have very few who are close to menopause who will never get a period again, and they are totally happy about it. Then we have some who we do the procedure, but because they've had some residual blood, will bleed for a little bit, stop, and then come back to a normal rhythm as well. But and we are very careful of not letting these particles go to the ovary. Just as I mentioned, if you have a knife and you're a chef, you should know what to cut and how to cut. The same way, we only want to go into the artery of the uterus, and there's a connection with the ovaries as well, and we make sure that we are not injecting anything to the ovaries, so we don't want the ovaries to fail. Somebody who's new at this or has not done it well enough could potentially put particles somewhere else, mainly the ovary, and that could kill the ovaries. We don't want that.
Mm-hmm. So we have had several questions about, how much this costs and if insurance covers it, and and what insurance you accept as well.
So we accept all insurances, number one. Now, some insurance plans, and there are a few, and I don't want to name them off loud here, but they kind of will fight around it and say, oh, well, it's, it's investigational, but it's just one or two plans that we know of. But we cover all. And it's compared to a hospital, when we do it outpatient, it's almost 1/5 of the price. And for those who don't have insurance, we will even work with them and make a payment plan. But trust me, it is very inexpensive compared to getting a hysterectomy.
Absolutely. What would you recommend for women who have a predisposition to diabetes or other hereditary diseases?
Yeah, so we focus on wellness first. See, unfortunately, people run around looking for diagnosis one to the other. And I get this. I have patients all over the world, and they'll say, well, what's my diagnosis? And I'll ask, how do you feel? And they go, I think I have this. And I'm like, stop. I asked you how you feel. What I mean to say is you got to focus on health first. So sugar is the enemy, as we all know. Smoking is the enemy. So you want to get yourself healthy, because just as we're learning in the COVID situation, you will start to deal with problems better. I teach my team this, and people that I can influence in my life and I live by this adage that wellness and happiness are not the absence of problems. They are the presence of solutions. So repeat that. Wellness and happiness are not the absence of problems. They are the presence of solutions. So if you're congenitally diabetic, but there's still solutions. Manage your blood sugar, get your insulin, all that, exercise regularly. And you don't have to be a triathlete, just basic stuff. We teach our patients how to meditate, do yoga, get into a very healthy lifestyle, and then you can deal with the problems of life and solve them and be joyful and happy.
Dr. Chopra, we have kind of more questions about the particles and the artery. And I know you talked about you're like a medical Navy SEAL, but one question is there only one artery, I'm sorry, that feeds the uterus? And if I have 4 fibroids, are you injecting into 4 arteries?
Oh, no, so I'm glad you brought that up. So let me show you this picture here, if you can see that.
Yeah.
You see, we get into the artery, whether I get in from the wrist or from the artery around the hip. The uterus, we have things on both sides, right and left. So there's one artery on the right to the uterus and one artery on the left to the uterus. So again, think of your garden and think of it that you have a right entrance and a left entrance. And there's one pipe into each. What we do is we get into the pipe that feeds the uterus, and you may have 55 or 1 fibroid, one big one. We don't go after each fibroid. We'll get into this artery, like you see this catheter here, and it feeds the whole uterus. So it's one on each side.
Okay.
And particles, as I was describing earlier, are these fine little particles that are basically, the ones we use are basically fine gelatin balls.
Sorry, I couldn't hear what you said.
Oh, I'm sorry, what was that? So basically, these are little gelatin balls. As you can see, they're floating here. And this is what gets into the body, into the uterus, and the body just absorbs it. So there's no radiation, there's no medication, there's nothing. And these are small little inert, it's like tapioca floating, but these are fine. There are some people will use other types of particles, but that's what this is.
This is a detailed question. Someone just got told yesterday that they have fluid in their right fallopian tube because she recently lost a job and insurance, and they sent her home. She's in pain. So how dangerous is it to wait until she gets insurance? So how truly dangerous is it?
I don't want to give medical advice on a webinar without seeing them. But
Right.
If you're in severe pain, I would make sure you evaluate it quickly on an emergent basis. And that's called a hydrosalpinx that they may have. It could be unrelated to fibroids. But if you're in severe pain, at least have it checked out to make sure there's no ectopic pregnancy. There's nothing else going on in there. So I would get it checked out sooner than later.
One person said, my doctor said my uterus is very enlarged, like a 20-week pregnancy. Would I still be a candidate?
Absolutely. I'll tell you one patient who found me on the web. She basically thought she's fit. She works out. She does everything. This is right in Chicagoland. And she found us on, I think, Google or something. And she watched one of my videos. And she came in and she had a fibroid, which was almost up to her diaphragm. So that's a full-term pregnancy size. She thought she was putting on weight, then she thought she was pregnant. So when she went and saw them, they said, well, let's collect enough blood. And I swear, I'm just quoting it. She said, you'll bleed like a stuck pig. And we make sure, and you have a 50% chance of survival with open surgery. Means out of 100, she had a 50% chance she'd come back home. So she was panicked. She actually found me on the web and called the office when she left that surgeon's office. Today, she's doing fine. We were able to get it from her wrist, do both sides, and she's done great. So no matter how big it is, we can do it. But we make sure we assess everything. There's no cancer there. There are no other problems. We study everything else and work our way from there.
Has any research been done about this procedure regarding cancer or other issues?
Yeah, there are hundreds of thousands of these that have been done around the world.
Yeah.
They don't cause cancer. But one of the things we make sure is that there is no cancer in the uterus. If there is cancer, and when you say malignant cancer means it's going to spread and kill you, we want it out of there. If it's benign and it's not a malignancy, then you can do the UFE.
And one person is asking, why not through the hip anymore and now through the wrist? And is there a choice?
Absolutely. I could do either. I can walk into my house through the front door, the back door, or the window. It's if the wrist is way easier for the patient, it's the same for me. And there's a few patients who, because the anatomy can change, I may not be able to do it through the wrist. For example, we go in through the radial artery, but we always make sure that the ulnar artery, which is the other artery, is fine. If they are not a good candidate, then we go through the artery on the hip.
Mm-hmm.
Both are easy.
Easy for you.
Have you seen LeBron dunk a ball?
Does this also help for endometriosis?
Yes, it can. So adenomyosis and endometriosis. But again, we evaluate to see what all is happening and how their symptoms are, etc.
Right. And so regarding kind of the cancer question, someone says, so do you perform a biopsy of the uterus first?
So what we do is first we do an MRI. If it looks normal, then you don't need to do a biopsy. The other thing we do is an endometrial biopsy, where the inner lining is checked to make sure that there are no cancer cells there. So the answer is yes, we do an endometrial biopsy.
After surgery, how do the fibroids die? Are they released during your period or using the restroom possibly?
So as I was telling you earlier about the different types of fibroids, and I'm going to show you a picture very quickly, and that'll explain it to you as well. If we have a fibroid that is what we call, let me just show you the screen, and that will make sense to you. Okay, so when we have a fibroid that we call is pedunculated and submucosal, as in inside the cavity, rarely this will shrink and kind of come out like a clot. Most of them, like the one we see here, will just stay in one place and just shrink away. And for example, if you see here the blood vessel, when it goes here, as the blood supply to this is cut off, just like the weed in your yard slowly shrivels away. Rarely, as I mentioned, if it is inside the uterus right here, what we call a submucosal pedunculated fibroid, this, as it shrinks, may break off and goes out like a clot. But 99% of these are just in the muscle and they just shrink away.
Wow. We have a question here. Having an IUD may affect the procedure?
No.
Question, and does IUD need to be removed before or after the procedure?
Actually, not. No. I mean, if you have an IUD, it doesn't come in my way at all. We are getting into the artery and we block the bleeding at the blood supply, so no, it doesn't. The IUD is kind of a completely separate purpose, whether it's to prevent the pregnancy or it's medicated for some women, especially who are having abnormal bleeding around perimenopausal. They sometimes get an IUD with the medication to help them, but it doesn't stop this procedure. If you have a fibroid and you happen to have an IUD in there, I can still do the procedure.
And then one final question before we totally wrap up. Actually, a couple quick ones. How long after the procedure do you see relief from the heavy bleeding? What is the follow-up? What if you no longer get your cycle? Could you make it come back? And can an IUD shrink a fibroid?
So there were a lot of questions in there, but
I know there were. I thought they were related. They all popped up at the last minute. So I want you to answer all of them though.
So the IUD will not shrink the fibroid. That's number one. Mm-hmm. Now, if you don't have your cycle, this won't make it come back in this procedure. It's not related to that. So as far as how long do you see the relief? Most of them, we see it immediately. But then some have some spotting for a while, but that heavy bleeding, cramping, all that starts to go away almost immediately or within a few days.
Dr. Chopra, thank you so much for your time this morning and answering the questions. Ladies, thank you so much for joining us. I was going to say, we hope this information has been helpful, but by all of the questions, it seems like it has been very helpful, and Dr. Chopra has answered so many really nice, even specific questions in addition to the general questions. And in the chat, people are saying thank you, very helpful. So if you are looking forward to connecting with MIMIT Health, I saw somebody in the chat earlier say they want to talk to you now to discuss their situation, then you can definitely do that. You can call MIMIT Health, and the phone number is area code 708-486-2800. And then the website, www.mimithealth.com. I see one person saying, please answer me. Let me see what I missed. She says, I had removed my fibroids last year, but my doctor said she was not able to remove it. So she removed part of it, but it got worse after the procedure, I'm thinking.
Yeah, well, basically it means she still has some fibroids, and probably the fibroids are getting worse. She could be a very good candidate for this, but obviously needs to get assessed.
So, yeah, so if it needs to get assessed, you know, perhaps you are a candidate to
Absolutely
touch base with MIMIT Health and Dr. Chopra so that you can discuss that situation, because she says it got bigger after 2 months. So it must be a fibroid. One last question, can the fibroid come back at some point in time after UFE?
So the ones that we have treated don't come back, but can you get a new one? Yes, but you know, I've treated hundreds and hundreds of patients and I've never seen that happen. Rarely, like I showed you the uterus, there's a blood supply that can come from another part. So out of maybe one out of a couple of hundred patients, we see that they may get blood supply from somewhere else, and it doesn't come back. What happens is they get blood supply from somewhere else. But I haven't seen that in my career, but it's been reported.
Mm-hmm. I think we may have, you know, either a poll for our audience, or at the very least, hopefully, oh, here's a poll. Yes. If you guys, ladies, I should say, could fill out this survey, that would be great. We'll give you a few minutes to do that. It will not go to the entire group. It will go to just the host and panelists. And so we will keep your information confidential. And then after this poll, we will definitely show you a slide that will give you the phone number. And I can even, while you're doing your poll, I can even put the number in the chat as well.
Yeah, the easiest way is to go to our website, mimithealth.com, MIMIT health.com. There you see it on the screen.
Yes. Perfect. Again, this has been, I wish I had talked to you in 2005, Dr. Chopra, because I definitely would have I would have rather have you go through my wrist instead of through my belly, but at least I wasn't out too long, but I was in the hospital for a day or two, so and it was a little uncomfortable.
What's very, very important to know is today, with the COVID-19 situation, the chance of you getting COVID goes way up if you're in a hospital where they have COVID patients.
Right.
Second is the cost part of it. So outpatient, recovering at home, and all that stuff is way better than being in a hospital situation. So that changes the paradigm tremendously today.
Yes, absolutely. Well, it looks like we've got people who have just been great. They have said they've heard about this from an email, from a friend, from social media. 100% said this information today was helpful.
Oh,
and
great.
Then 92% feel that they are ready to address their fibroid condition. I think that is a definite win.
Yeah, thank you. I'm grateful that folks found this helpful, and thank you for giving me your time on a Saturday morning. And I hope we can be a solution for you.
And you know what, you were on Channel 5 this morning, and someone saw you on Channel 5 this morning. So
Oh, okay, thank you.
they
Good
are
to hear.
great. They have had no idea how she got the email, but this has been so helpful. She's ready to fly back to Chicago to see you, Dr. Chopra. So
Thank you.
are going to have personal visits from our ladies.
Thank you. If I can be of help, absolutely, it's a blessing.
Well, thank you all. We're going to end our webinar this morning, but you have put in your information for MIMIT Health to find you. And then again, if you did not, definitely follow them on, visit their website, follow them on Facebook, and you have the number and the website, and so you can be in touch. And this will also be available on YouTube for others who may have missed today and who want this information. You can be a witness to them and tell them, go on YouTube to hear what Dr. Chopra has to say. Thank you, everybody, and have a great day.
Thank you. Bye-bye.